Hi, Sandra Van Gilder here at G3 Physical Therapy, where I'm talking about how through a whole body approach you can really help heal injuries. And today I'm going to be talking about the lower back. Usually when somebody throws out their back, it's because they're overusing their back and they're underutilizing the rest of their body. And also one of the one things that I hear all the time is that we're not supposed to twist. So there's a good reason for that, and I'm going to be showing you. So the lower back from an anatomical standpoint, if you notice how these little bones, when you try to twist them, they knock against each other. So you turn one way and they hit each other, they hit another, they turn other way. So see how there's only about 5 degrees of movement from each side before they bump into each other. Those little surfaces of bone are called facets. So you don't want those facets to bump into each other. When they do, what happens is that's when sometimes you feel like your back muscles are seizing up and you can't move and you have to lay on your back for a while. So that's a big problem, right? But how do you prevent that? Because when you're trying to move and function in everyday life, you are rotating. You have to rotate. So this is where it gets really, really fun, because if you look at what's right below the lumbar spine, these the vertebrae, is this huge pelvic area where you have all these huge glute muscles that are diagonal. And so what that does is that those are made to rotate. You can tell from the anatomy that these lumbar facets are not made to rotate because they bump into each other, and that's going to hurt you. But the rest of the structures below are made to rotate. And if you look at your upper back, so this is your head, your skull, this is, you have 7 vertebrae of your neck, and then it goes into your upper back where you have your rib cage attached to it, and on top of that you have your shoulder blade, your scapula. So if you look at how these rotate, they rotate so nicely. So there are over 45 degrees of rotation in that area. So these are places that are meant to rotate. However, with our daily life, with poor posture, if you're sitting a lot, if you're looking at the computer a lot, if you're like this, then that those joints get super tight. So then basically you're not utilizing good motion that you're supposed to have there. Oh, sorry about that. Gonna hook that up because I wanted to show you that lumbar spine right here. So you have the lumbar spine, the vertebrae, and then you have these hip flexors that attach to it. And again, even those are angular into your hips. So everything is involved in connecting to the hips. Okay, so if you can release this hip area and you can release this upper back area and you allow those 2 areas to twist and turn, then the lower back doesn't need to twist and turn. Okay, so I feel like that is kind of the biggest secret that most people don't realize and don't know that can really help them, is that when you have lower back pain, once you throw out your back, it seems like it takes weeks to get better. And then what happens is that that might happen once a year. And then over time, it happens twice a year. And then before you know it, you're avoiding activities that you really enjoy. And then you start to get, and that what happens is that that gets your muscles become tighter and tighter because you're not using it. So it becomes a vicious cycle where you throw your back out more often and more often until you feel like, gosh, you know, some people need surgery, some people need epidurals and shots to manage that pain, when in reality, there's so much you can do before you get to that point. So I really want to encourage you to reach out, ask questions. If you suffer from lower back pain, if you suffer from pain from sciatica, oftentimes postpartum moms, because you've been so stiff from being pregnant and not being able to move for 9 months, and then on top of that you have that relaxin hormone, which makes you too lax. So you have tightness and you have laxity all at the same time. That can cause lower back issues, sciatic issues, And there's so many things that you can do. And breastfeeding definitely is another reason that we tighten that upper area up a lot, because we're hunched over. So if you have relate to any of the things I say and you're still suffering from these problems, reach out, ask questions, educate yourself on this, and we would love to help you, because life's too short to not enjoy everything that we love. So hope this was helpful, and I will see you soon.